Other health conditions can be a sign of CKD. This is because when your kidneys aren't working well, it can cause other problems such as anemia happens when there are not enough red blood cells in your body. Red blood cells carry oxygen through your body, which gives you energy and helps your muscles, bones, and organs work. Anemia can make you feel weak and tired. Gout is a type of arthritis that causes pain and swelling in your joints, usually in the big toe. It can be very painful. CKD can cause gout, or gout can cause CKD. High potassium or hyperkalemia is too much potassium in your blood. Potassium is a mineral and an electrolyte that comes from the food you eat. Your body uses the potassium that it needs, and your kidneys remove any extra. But when you have kidney disease, your kidneys cannot remove extra potassium, so too much stays in your blood.
If you find out you have CKD early, you may be able to stop kidney damage from getting worse. Damage to your kidneys is usually permanent and cannot be fixed, but you can slow or stop it. This is why it is important to get tested and find CKD early, such as in stages 1 through 3. It is especially important to get tested if you have high blood pressure or diabetes. Although you cannot fix damage to your kidneys, when you know you have CKD, you can take steps to keep your kidneys as healthy as possible for as long as possible.
Anyone can get CKD, but some things can make it more likely to happen to certain people. You may hear a doctor say you are at risk for CKD or have a high risk of CKD, which means you are more likely to get it. You may be more likely or at risk to get CKD if you have diabetes. Diabetes is a disease in which you have too much sugar, also called glucose, in your blood. Have high blood pressure. Have heart disease. Have a family member with kidney disease. This is because there are different types of kidney disease and some of them run in families, which means they are genetic, such as polycystic kidney disease, the disease that causes cysts to grow in the kidneys. Are Black American, Hispanic, Native American or Asian American? Doctors and researchers are not exactly sure why, but it may be because diabetes and high blood pressure are more common in these groups. If you are over age 60, this is because as you get older, your kidneys naturally do not work as well as when you were younger. Older adults are also more likely to have diabetes and high blood pressure. Having one of these risk factors does not mean that you will get kidney disease. But if you find and treat kidney disease early, you may be able to prevent it from getting worse. If any of these apply to you, ask your doctor to get tested and how often you should be tested.
Diabetes is a disease in which you have too much sugar, also called glucose, in your blood. Over time, high blood sugar can damage the small blood vessels in your kidneys and cause CKD. Think of your blood as tomato juice. It is thin and moves easily. When you have diabetes, too much sugar in your blood makes it thicker, more like ketchup. This makes the blood vessels in your kidneys work harder to filter your blood, which damages them. To check for diabetes, you need to have a blood glucose test to check the amount of sugar in your blood. You can ask your doctor for this test. Fasting blood glucose is a test of your blood sugar after not eating for at least 8 hours. It is usually done in the morning, after fasting overnight. A normal blood glucose level after fasting is between 70 and 99, in other words, less than 100. If your level is between 100 to 125, you have prediabetes, which means you have a high risk of getting diabetes. And if your fasting glucose is 126 or higher, it means you have diabetes. Your doctor can also do an A1C test to check for diabetes. A 1C is a measure of your average blood sugar level over 3 months. A 1C test results are reported as a percent. The higher the percent, the higher your blood sugar levels over the past 3 months. A normal A1C test result is less than 5.7%. If your A1C is between 5.7 to 6.4%, it means you have prediabetes or are at risk of getting diabetes. And if you have an A1C of 6.5% or higher, you have diabetes. Your doctor can also use your A1C to see how well you are controlling diabetes. For adults with diabetes, the goal is A1C that is less than 7%. Source: American Diabetes Association. 2020 Diagnosis. Retrieved from https://www.diabetes.org/A1C/diagnosis.